Next, as soon as you put the blade in, if you see that there's mucus there, suction. You know it's going to be a problem if you put the camera into the muck. So suction as you go. Now, the one other additional nice thing about using a channeled blade, I mentioned that you can direct both the blade and the the blade and the tube with one hand. Well, that leaves your other hand free to do something like suction with. Now, because there may be some really big chunks and you need a high volume suction, you have to make sure that your, I'm not quite sure what this little hole is, but carburetor, for lack of a better term, is closed. There's not a whole lot of benefit to leaving it open, so my recommendation would be grab a piece of tape and just tape over it. That just keeps it closed. The next thing that we all know, but we have a tendency to do anyway, is if you put this right up against soft tissue, you're likely to lose your ability to suction. So just be wary of where your tip is. All right, so to put this together, I'll go through a demonstration here and we'll be able to show you what we're seeing. Preload the tube, preload the bougie, and because of some recording issues, I'm not going to decapitate the head. Fortunately, we can get away with it here. Insert just the tip, do it in a midline fashion, begin suctioning, and keep the tip of the suction distal to the tip of the camera. The idea is that you're trying to keep the muck away from the camera lens. So aggressively suction your way down and walk the tip of the blade around the tongue. So keep the tip of the blade in contact with the tongue.